Hi guys, welcome to my channel. Today I'm going to discuss the cholinergic antagonist, the remaining one in which we are going to discuss the scopolamine and other antagonists, their therapeutic uses and adverse effects. In previous slides, we have discussed the atropine, which is very important drug for your examination point of view. So let's start our video. I hope you will watch this video till end so you can understand each concept, and if you have any question you can ask me in comments. So let's start our video. So number one is a scopolamine. Scopolamine, another tertiary amine plant alkaloid, produces peripheral effects similar to those of atropine. However, scopolamine has greater action on CNS. Unlike atropine, CNS effects are observed at therapeutic doses and a longer duration of action as compared to atropine. It has some special actions as indicated below. So we are going to discuss its actions. Here in this paragraph, the important point is scopolamine is an alkaloid. It is the chemistry of this medicine, of this drug, which produce peripheral effects. जो peripheral effects produce करती है similar to that of the atropine. Whatever the effects of atropine, the scopolamine effects are same. But the difference between scopolamine and atropine is that it has greater action on central nervous system. And unlike atropine, CNS effects are observed at therapeutic doses. So even you give the scopolamine a therapeutic dose, it gives the central nervous system effects. Or in case of atropine, when you give high dose, not the therapeutic dose, the high dose other than the therapeutic dose can cause the CNS. But in the scopolamine case, the CNS effects are more as compared to the atropine. This is the major difference between scopolamine and the atropine. So these are the actions of scopolamine. Number one, the most important one is anti-motion sickness drug. The second one is it has some unusual effect of blocking short-term memory. So it blocks the short-term memory. You can learn these effects on the finger points. So anti-motion sickness, short-term memory, block the short-term memory loss. Like if the patient has dementia or the short-term memory loss, then scopolamine may help in blocking this short-term memory. In contrast to atropine, scopolamine produces sedation, but at the higher dose, it can produce excitement. Scopolamine may produce euphoria and is susceptible to abuse. So scopolamine has some abusive effect and it causes a sedation. But if you can give the higher dose, it can cause the excitement. So euphoria, like it's quite similar effects like that of the antidepressants. So actions of the scopolamines are have three main actions like anti-motion sickness, blocking the short-term memory, and has antidepressant effect. So the therapeutic use of scopolamine is limited to prevention of motion sickness and post-operative nausea and vomiting. For motion sickness, it is available as topical patch that provides effects for up to 3 days. So motion sickness, what is the motion sickness? Motion sickness is a sensation of wooziness, like if you are traveling through by the car, by boat, by plane or train, some people feeling nausea and vomiting. These because of the traveling. Your body's sensory organs send mixed messages to your brain, causing dizziness, lightheadedness, or nausea. Some people learn early in their lives that they're prone to condition. So motion sickness happen to those people who are maybe suffer from the motion sickness when they're going by the car and even in any case of traveling. So there are some patch available that help to prevent the motion sickness for up to 3 days. Like 3 days you can travel without any nausea and dizziness condition. As with all drugs used for motion sickness, it is much more effective prophylactically than for treating the motion sickness once it occurs. So if you have any plan for the traveling, so you can take this patch before the traveling. So it helps to prevent the motion sickness during your traveling, because it prophylactically act, but during the travel if you take this it can't stop the motion sickness. So it helps to prevent it but it can't treat. So this is the point too. So it helps in prophylactically, not treating the motion sickness. Once it's happened during the traveling, you have to take the other medication. So this is a very important therapeutic use of scopolamine. And here is the pharmacokinetics and adverse effects, which is similar to atropine. So another drug, ipratropium and tiotropium, you are well familiar with this drug because these drugs are used in the COPD patient, the chronic pulmonary disease, for the bronchodilation, because in the COPD patient there is bronchoconstriction happen. To relieve this bronchoconstriction, there is a need of some kind of dilators, and these two dilators are very important because they affect on the receptor which are present on the lungs, which are present on the bronchioles, and it helps in the dilation of these bronchioles. So this is the very important therapeutic use of the cholinergic antagonist. Ipratropium and tiotropium, which are quaternary derivatives of the atropine. These agents are approved as bronchodilators for the maintenance treatment of bronchospasm associated with the chronic obstructive pulmonary disease. Ipratropium is also used in the acute management of bronchospasm and asthma. So if the patient has have asthma condition and there is a bronchospasm, so in the inhaler or in the medication, ipratropium is present. Both agents are delivered by inhalation because of their positive charges. These drugs do not enter the systemic circulation or the CNS, isolating the effects of the pulmonary system. So these drugs are present in the inhalers, which mostly you have seen the asthma patient are taking the inhalers, and these inhalers help to go these drugs directly into the pulmonary system rather than going to the other CNS or system, which reduces or minimizes its adverse effects. Tiotropium is administered once daily, a major advantage over ipratropium, which requires dosing up to 4 times daily. So the ipratropium and tiotropium is the newer form. You can give the once daily dose that helps to dilate your bronchioles throughout the day instead of the ipratropium, which require 4 times dosing. So this is the important point for the clinical point of view. This is a very important chart in which uh, they have explained some therapeutic uses of the cholinergic the cholinergic antagonist, are also known as the muscarinic blockers. So these you have to learn these clinical points. So it helps to pass your Viva exams and also the multiple choice question like trihexyphenidyl and benzotropine treatment for the Parkinson's disease. We will study in the Parkinson's disease these drugs more importantly, but here you have to learn that trihexyphenidyl and benzotropine TB drugs help in the Parkinson's disease. Dariphanazine, physotyrosine, oxybutynine, solifenacin, toltyrosine, and trospium. These are the combination of antagonists. Like all these drugs have the same effect which are used in the treatment of overactive urinary bladder. However, the dosing of these drugs are different. We will discuss in the later slide. But here, the other one are cyclopentolate, tropicamide, atropine. These are used ophthalmology to produce mydrosis and cycloplegia prior to refraction. So mydrosis means dilatation of the pupil, and they produce by these drugs you can learn is with the CTA drugs. The mnemonic for this is CTA, and the atropine are used for the treatment of the spastic disorder of the GIT, treating organophosphate poisoning, suppressed respiratory secretion prior to surgery. Because we have discussed previously, like atropine decrease the secretion. Atropine has effect to decrease the secretions. So this is used for the treatment of the for the suppression of the secretions prior to the surgery to do bradycardia. Scopolamine prevent motion sickness. Ipratropium and tiotropium treatment of the COPD. Ganglion blockers include nicotine, which include the smoking cessation. Tropicamide and cyclopentolate, these agents are used as ophthalmic solutions. Madrasa and cycloplegia we have discussed in TC in the chart. So this is the duration of action is shorter than that of the atropine. Tropicamide produces madrasas for 6 hours and cyclopentyl for 24 hours. So the cyclopentyl has madrasas effect prolonged as compared to the tropicamide. So the difference between these drugs is just the dose and the duration of action. However, the effects are same. Benzotropine and trihexyphenidyl. Benzotropine and trihexyphenidyl are useful as adjuncts with other antiparkinsonian agents to treat Parkinson's disease and other types of the Parkinsonian syndrome, including antipsychotic induced extrapyramidal symptoms. We will discuss this drug in Parkinson's disease, but here you have to learn the BT drug, benzotropine and trihexyphenidyl are used for the Parkinson's disease. So dariphanasine, physotyrosine, oxybutyrine, solifenacine, tolterodine, and trospium chloride. These drugs are used for the overactive bladder. By blocking muscarinic receptor in the bladder, intravesical pressure is lowered, bladder capacity is increased, and the frequency of bladder contraction is reduced. That's why they are used to treat the overactive bladder. Side effects include dry mouth, constipation, blood vision, which limits tolerability of these agents if used continually. Oxybutyrine is available as a transdermal system topical patch, which is better tolerated because it causes less dry mouth than oral formulation. The overall efficacies of these antimuscarinic drugs are similar. So the very important point is they are used to treat the overactive bladder. So if some people have problem to urination, to early urination, even by sneezing, so these drugs help in improving the bladder capacity, in improving the bladder capacity and the bladder activity. So the bladder capacity is increased and frequency of bladder contraction is reduced. So less bladder contraction occur. That's why the overactive bladder treatment happen. So it treats the urine problem. So this is all about the cholinergic antagonist. In the previous slide we have discussed the atropine, and in this slide we have discussed the scopolamine. Therapeutic uses of scopolamine, ipratropium, tiotropium, therapeutic uses which is used in the COPD patient. Then we have discussed some summary of muscarinic blockers and the ganglion blockers. Then tropicamide and benzotropine trihexyphenidyl drug which is used for the Parkinson's disease, and the group of drugs which are used for the overactive bladder. And the important point is oxybutyrine is available as transdermal patch, so it helps to reduce its side effects. So I hope you like my video. Kindly subscribe my channel. Never forget to click on the bell button.